on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com.
Great,
now,
because so many guys
let's
are
get
close.
informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. Here Tuesday, April 16th. Wow, cruising through April. And like I said, You and Your Doctor show, and tonight our doctor is Dr. Alan Parrerson, very experienced OB-GYN in the Coral Springs area, neighboring Coral Springs, great area, and for a long time in Boca Raton as well. I know he still has some ties to Boca Raton, so we'll get into that. It's OB-GYN-Patterson.com. We'll give that out a few times, too, as well. But without further ado, welcome to the program, Dr. Patterson. How are you doing this evening?
I'm doing great. Thanks for having me on again. It's always a privilege and a pleasure to be on with the best radio talk show host, the incomparable David DePino.
Oh, thank you for that. I appreciate that. And thanks for making it through that Boca traffic this evening. I did the same thing. It seems like the snowbirds aren't leaving this year, so I guess that's good for someone like you because it builds business. But it's hard to believe, but we're halfway, almost halfway through the year.
Right.
And I've had you on a few times. We've talked a lot about obstetrics because you've delivered so many babies. I think last time we had you on, it was like 5,600, and you were telling me before we went on is you've delivered close to 5,800 babies or a little more than that?
Close.
Wow.
Close.
That's awesome.
5,700 plus.
Yeah, that's great. So we've talked about that a lot in the past. So today I want to do a little bit more about women's health. And like I was saying, we're almost halfway through the year. October is the main breast cancer awareness month, and that's only 6 months away. So I want to ask you, for women, the modern woman, so many different, pulled in so many different directions with work, being a mother, the family life, home, etc. Why is it important to the modern woman to do monthly breast exams themselves, so something that they can do at home? And then also the second half of that question, why are breast exams important?
Sure, it's very important to do monthly self-breast exams, and you want to do that after your period, not before. You check each breast there. You can go online and they can show you how to do it, because your breast, you should know what your own breasts feel like. If you ever feel a lump, it may or may not be something bad, but then you would tell your healthcare professional, because if you feel it first, you're going to go there sooner, because maybe you're only coming in once a year for your well woman exam or twice a year. So if you find something, you go to your healthcare professional, they examine you, do the appropriate testing, and hopefully it's benign. But if it's not benign, you caught it much earlier than if you would have not checked yourself. So it's so important to do monthly self-breast exams, and every woman should make it part of their monthly routine.
I remember with men with doing the check for testicular cancer, they said, I remember all the way back to school days, if you felt something that was like the size of like a pea and it was hard, that's definitely, let your doctor know. Is it different from breast? Are the lumps bigger in nature, or is it about the same?
You can have any size lump. They could be
really?
pea size, it could be a centimeter size, it could be 2 centimeter size. The odds are in your favor that it's probably going to be benign, but you don't want to assume anything, and you can do the appropriate testing. And then when assuming that if you feel something, then your healthcare professional can order a mammogram and an ultrasound, or maybe both, or other testing if need be. As far as screening tests, most people recommend getting a baseline mammogram at age 35 to 40, and if that's normal, then you start with regular mammograms at age 40. Some people say to do them every year. Some people do them every 2 years, but most people should do them at least every 1 to 2 years, because a mammogram can often see things that you can't feel, and you wouldn't want to miss something and let it go. And when you could have done something about it.
So I think the key there is primary care and preventative care. Always bring something to your doctor. As soon as you find out, let them come up with a plan and do the testing as well. And I want to ask you, and I think you kind of answered a little bit, but how often should an adult woman schedule a mammogram? You gave the years there, the ages, but in terms of, is it something that is done yearly?
What depends on the person and what they have, either 1 to 2 years.
Okay.
A lot of times it depends what they read the mammogram. Sometimes people have dense breasts, and it's better to check with a mammogram and an ultrasound every year. If you have a category 1 mammogram, which is totally normal, some people may say it's okay to do it every 2 years. But depending on your situation and your family history, most experts recommend that you do, starting at age 40, your mammogram every 1 to 2 years.
Now, are mammograms done in the office, or is that something that's done outside?
Well, some practices may have a mammogram machine in the office, and some is the outpatient radiology center. So it just depends on what the situation is. But you want to go to a reputable place. And now there's the digital mammogram, which is much better than the older kind. It's more accurate. It doesn't hurt as much, and it gives a much better reading. So mammograms have improved along with everything else in medicine in this great country that still has the best medicine in the world, in my opinion.
Yeah, and you're right on about that. We have doctors like you on the show all the time, and we're always learning, whether it's the technology they bring into their office or, the latest and greatest, and just staying up on everything. I'm with you on that. We do have the greatest medicine in the world. Again, here with Dr. Alan Parrerson, OB-GYN and infertility. I was reading on your website, I think you've been here since 91, but you did about 8 years in private practice up in Indiana before that.
Right. I'm originally from Indianapolis. I went to college at Tulane, went back to Indiana University Medical School, did my residency at a very good private hospital in Indianapolis, St. Vincent Hospital and Healthcare Center. Then I practiced in Indianapolis from 83 to 91, and I moved down here in 1991. I've been down here ever since.
Wow, undergrad Tulane in New Orleans, and then Indiana U, man, with for grad school and in the medical school, and wow, the two great hot spots for sports. So I bet, and you're a sports guy, so I know you were able to see a little bit there in the college days.
It's great. It was great.
That's awesome. We're here with Dr. Alan Parrerson, OB-GYN and infertility. I'll mention that too. His office is in Coral Springs. It's the website is OB-GYN Patterson, so that's OB-GYN Patterson.com. Ton of info on there, doctor. Great website. You were telling me before I had asked you people can also book online there, and if there's some openings, they can see you pretty quickly.
Right. You can my patients can either call our office and talk to my great staff who gives you personalized care. All my staff knows my patients very well. You get that personalized care at my office, or you can book online. You have either option. We try to make it as easy for the patient as possible. We're on most major insurances, and we can help check your benefits if you have questions about a specific procedure that needs to be done or office visit. My great office manager, Kim Smith, who's been with me for years and years and years, is the best.
That's great. It's 954-755-9311 or OB-GYNPatterson.com. Again, OB-GYNPatterson.com. So I think I've had you on more than any other doctor. We were talking before. I think this is the 5th time I've had you on, so I think you've just took the lead over Dr. Nils Mueller, interventional neurologist. So I'm sure when Dr. Mueller hears this, he's going to want to tie you for the lead. But thank you so much over the years for coming onto the show. And I've shared my experiences on this show. My daughter Daisy, you asked, she's almost 2 years old. So
that's great.
The last 4 times I've had you on, I've asked you a lot of baby questions, and I promise I just have 2 more. So I wanted to ask you one of the ones. Where do you deliver babies? Are you still both hospitals in Boca Raton?
Right. I go to Boca Raton Regional Hospital and West Boca Medical Center. They're both great hospitals. They both have great obstetrical units. I've been on both ever since I've been down here. So the patients have a choice of either one of those hospitals, which are tremendous hospitals for obstetrical care.
That's great, and that's almost 3 decades on staff at both hospitals. Congratulations. And they're both great birthing hospitals. I've heard great things about both of them as well. My last baby question.
No problem.
And then we'll go on to women's health because I do want to get a little bit more of your expertise on that. Why is prenatal health so important in your opinion?
Well, everybody needs prenatal care because you want to make sure that everything is okay with yourself and your developing baby. There's certain testing we always do, that there's blood tests, cultures, ultrasounds, because we want to have a healthy mother and a healthy baby and not any surprises. So in the United States, there's no reason not to go for prenatal care and not to deliver in a great hospital or a birthing center. I highly recommend against home delivery because nobody knows what's going to happen when you're in labor. Hopefully everything's okay, but you can have complications during labor or after labor that if you're at home could be a disaster, where they're easily handled in a great obstetrical hospital or a birthing center. So that's my plea to mothers. Don't take a chance with your health. You can't predict the future. In the United States, you should be delivering in a great certified birthing center or fine hospital like Boca Raton Regional Hospital or West Boca Medical Center or any of the other fine hospitals in this area that have obstetrical units, of which there are many, all the way from Palm Beach down to Miami. So there's no excuse to not go to a hospital or a birthing center, in my opinion.
And I second that as well. I mean, it's great having a doctor on staff at a hospital who can, as another sports analogy, quarterback the situation. You've been experienced 5,800 births. I mean, you have that what is the word I'm looking for at a hospital? You have the resources right there, right on site. So that's huge, and you were making that point. So,
and it's the entire team also. It's not just me. It's the great nurses, all the staff at the hospital, the facilities, the drugs, the anesthesia, the peds, everything. It's a team. It's teamwork. And if there's something wrong with something, you have the healthcare professionals there that you do not have at home.
Yeah, I second that as well, going through the process. So I want to share a couple of things and questions I have. Women's health, is a topic for, all days, all months of the year. And we talked a little bit about Breast Cancer Awareness Month, which, after the summer, it'll be here before you know. And that's the really big campaign. But that's stuff that, awareness that should be happening all year long as well. What are some of the most common ailments you treat? Like, what's walking into your office? Like, what's some of the things, conditions, ailments?
Women can have all types of problems. Vaginitis is very common. Abnormal vaginal discharge can be due to a number of reasons, and you shouldn't guess. You should see your qualified healthcare professional, because we can do an examination, cultures, properly diagnose and treat. Sometimes if you try to self-treat, you may be treating with the wrong medication and actually make it worse. Also, we see people that need STD testing, either want to be screened or they're worried about exposure, which is important because if you have an STD, you want to get that treated as soon as possible and treated properly, or can have bad complications. Also, you'll see a lot of people with abnormal periods or bleeding problems, bleeding in between periods, heavy periods, cramps with periods. There's no reason to suffer with that, and you want to have a proper workup, as usually it's a benign condition that can be treated appropriately by a qualified healthcare professional, but sometimes it could be a precancer or a cancer, so you wouldn't want to miss that. Those are many things that we see. People come in with other problems, fibroid cysts, pelvic pain, endometriosis, the whole gamut that I treat in my office.
And I apologize about all that ambient sound there. That's my phone's going off, but a lot of people are sharing the show. I put both of the volumes on low, but it still didn't catch there. Well, Dr. Parrerson, hold that thought. On the other side, I want to ask you a little bit more about STDs, because I did a little research this afternoon. I was really surprised at what I found and what's going on in this country on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Longer and healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Living a Longer and Healthier Life show. And tonight, helping us, find out the info on living a longer and healthier life is Dr. Alan Parrerson, OB-GYN and infertility in Coral Springs. It's OBGYNPatterson.com, 954-755-9311. I'll definitely give that it again. I want to talk to you a little bit more about STD testing, STDs, sexually transmitted diseases. And the little research I did today seems to be on the rise in a lot of different categories. Let me ask you though first, in terms of the testing process, someone wants to get tested, they book online on your website, they come into the office. Is that something that's done in the office, or is it sent out to a lab, or kind of combination of both?
No, we do the testing in the office, but we send you come in, and certain STDs you do cultures and some you do blood work. So it's sent to a certified lab, and then you get the results, and hopefully it's negative. If it's positive, then you treat appropriately. And I would recommend that when somebody has a new sexual partner, you both come in for STD testing before you have relations, so you know if you have something or not, so you don't end up giving it to the other partner if you have something and don't have any symptoms, because many STDs can have no symptoms, and if they lay dormant for a while, and then they can cause bad problems if they're untreated, and that's how a lot of the problems happen. And also, you want to practice safe sex. You want to use protection, because anybody can have anything. So any board-certified OB-GYN or healthcare professional should be able to test women for STDs, and the men can go to urologist and have appropriate testing, or their primary care doctor. So there's no excuse not to go for STD testing, and you want to make sure you don't have anything and give it to somebody else.
That's a great point, Dr. Parrerson. And one of the studies that I was referencing to, that I did some research before I having you on, was the Centers for Disease Control and Prevention, the CDC, put out Sexually Transmitted Disease Surveillance 2017, which they say is the most recent statistical data on nationally notifiable STDs. Before I get into some of the reporting there, if left untreated, now we talked a lot early on about preventative care in this segment and of this radio interview, but if left untreated, now most of these can be treated pretty what is the word? Effectively.
Most of them can be treated effectively, and you can get rid of the STD. Obviously, with HIV, you have to monitor it, but you can make it so it doesn't progress, so people can live a long life now, not unlike the past. But most of them, you can get rid of the STD, because if you don't, a lot of them can cause infection in a female, can cause infertility, which is really a shame. I've seen that happen to young women that had STDs, and it caused a pelvic infection in their uterus and tubes, so everything was ruined, so they couldn't get pregnant. Things like syphilis that you just read an article about Al Capone that you were going to bring up. That can cause, if that's left untreated, it can cause skin lesions, and then tertiary syphilis goes to the central nervous system, which is really a shame, because you can do blood testing to identify if you're positive for syphilis. So in this day and age, nobody should ever get tertiary syphilis. That should be a disease of the past, just like nobody should really be getting cervical cancer, because you come in for pap smears, and a pap smear will catch pre-cancer before you get cancer, and also with the HPV vaccine that helps prevent women from getting HPV, which leads to cervical precancer and cancer. So nowadays, if you go see your doctor and do the proper testing, you shouldn't get the things that people used to get many years ago.
Yeah, that's correct. And thank you for bringing up the Al Capone. So I was just bringing up here, I found an interesting article by a doctor, Dr. Howard Markel wrote it, and you can find it on pbs.org, Public Broadcasting Systems website. It's a great little article about Al Capone. So Al Capone, he knew he had syphilis when he was running the gang there in Chicago, and he kind of didn't want to do anything about it. He didn't want a lot of people to know he had the lesion, and then it became that tertiary. And actually, when he was at Alcatraz, I read in this article that he really went wacky because it had traveled central nervous system up to his brain. He actually died of the disease at 48 years old. A lot of people think he died at a much older age, but he had it probably for a good almost 20 years, it looks like, if you do the timeline. So that's an interesting tie-in, but that it in the article it said it could have been treated early on. Probably there
right,
were some
it could
things
be treated with antibiotics. We'll get rid of it if it's treated early on, and it should never get to tertiary syphilis because once it gets to your brain, it's all over. It's history.
Yeah, and this was the early 1900s. There was even some drugs that were used back then.
So he could have gotten treated, and even as time went on, he could have gotten treated. So maybe it didn't get to tertiary syphilis.
Yeah,
but it's so important for when people to get STD testing and to use protection. There's male condoms, and now there's a newer female condom that works very well that females can use.
Again, it's Dr. Alan Parrerson, OB-GYN and infertility. Coral Springs is where his office is located, OB-GYNPatterson.com. I'm going to give out the number, 954-755-9311, or on the website, OB-GYNPatterson.com. You can actually book online there as well. So that's great news. Great opportunity. See if there's an opening when Dr. Patterson's office, and he can squeeze you in. So the address over there in Coral Springs, 7451 Wiles Road, Suite 205, Coral Springs, 33067. So definitely an option for you in women's health right here in the area. A great option. And got some great reviews there. I was reading them. Man, you got a lot of reviews on your site. That's great. That patients take the time, and you're very high rated. 4.91 out of 5 just on your website there.
Well,
so
I appreciate that. I have loyal patients. They've been with me a long time. I give them the care that they want, and they come back to me. So, I have a very loyal patient base, but I am accepting new patients, and we are on most major insurances.
And a beautiful office. I haven't been there in person, but just seeing the pictures online with all the antiques in there, that is awesome.
Thank you. Yeah, very nice office. Is very well done. My lovely wife, intelligent. She's the best. Gorgeous, smart. Her and her mother are in the antique internet business, so they buy and sell antiques online. So they said, we're going to furnish your office. It's going to have a European look. It's going to have more class than most medical offices, and they did a really good job, and I'm very happy with it, and I thank them so much for doing that.
Thanks for sharing that, and you can see the pictures on OBGYNPatterson.com. I just want to give out these stats, and then we never have enough time, so I want to do the last segment a little bit about sports, because me and you are huge sports fans. And
definitely.
You definitely got me covered, and your tie into the Boston Marathon. But really quick, this is why STD testing is so important. The CDC reporting a 22% increase since 2013 in chlamydia. That's 1.7 million cases. That's obviously gone up. A 67% increase in gonorrhea at 555,000 cases. A 76% increase, 76% in syphilis at almost 31,000 cases. So definitely, if something's not right, get tested. If you're a man, urologist, Dr. Patterson said, and he knows some as well. And if you're a woman, a gynecologist like himself. So I know they're giving me the 2 minutes. I know you're passionate about sports, so you ran the Boston Marathon in 89 and 90? That's awesome.
Right. It was a great experience. I ran like 6 marathons in like about 2-year time frame, but the Boston is the best marathon. They just had the Boston Marathon yesterday, Patriots Day, and I ran my last marathon in 1994, the very first Disney World Marathon. That was a great marathon also, but nothing beats Boston. It is the best marathon.
And to qualify for Boston, you said you ran Chicago, and before that, San Diego.
I ran Chicago, then San Diego, then Boston that year.
That's
and then I
really
ran Boston in 1990, so I did it 2 years in a
took
row.
care of your bucket list early.
Had to.
Yesterday, I was watching the Fenway Park, the Patriots Day, Orioles and Red Sox, and the Boston Marathon, and split screen over here. I have a friend in the PR world, Melissa Perlman, who actually finished 3 hours and 7 seconds, 174th woman to finish. We have just a minute. Pacers, he's got his Pacers scrubs on. They're only down by 1 game. They lost 84-74 without Oladipo in the first game, but they're going to bounce back. Game 2.
Hopefully, they lost their best player for the year. Most teams wouldn't be in the playoffs, so they're playing great. And when they get him back, they're going to be even better. And hopefully next year, the Heat will also be in the playoffs because it's exciting when the Heat are in it also. But I'm a diehard Pacer fan, so go Pacers game 2 tomorrow night.
Awesome. Thanks, Dr. Patterson. OB-GYN, Patterson.com, 954-755-9311. See you next time.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthy